So you are on loan from the CDC, where you are the director of the Division of HIV Prevention at the Centers for Disease Control and Prevention. And we will talk about HIV specifically in a moment. But there's a story in the New York Times today that brings the two. Monkeypox, for those who are not initiated, is now Mpox. The link between Mpox and HIV, that people who have Mpox should also be tested for HIV. Talk about the significance of this story.
Sure. So the significance really is one about interacting epidemics that are made worse by social determinants of health. We've heard a lot about that today. That's called a syndemic. And so Mpox does not live in isolation. It interacts with other infections, as well as sort of social circumstances that makes those infections worse and impacts communities. So, I'll say back in September of last year, there was a publication from CDC that showed that 41% of people who were diagnosed with Mpox were also living with HIV. In October, another publication came out from CDC and MMWR that really focused on the 57 severe cases that they heard about hospitalized individuals. And at that time, what they found was that over 80% of them were living with HIV. Only 10% of them were taking antiretroviral medications. And many, many of them, the vast majority, had T cells of less than 50, which I haven't seen in a cohort that large since I did medicine in the 90s. And so definitely recent data that's emerged from Chloe Orkin, who's a fabulous clinician from the UK, really affirms the fact that Mpox does not live in isolation and more severe disease can occur in people living with HIV, which is why when you think Mpox, you need to think HIV testing as well. In fact, when you think HIV testing, you should think Mpox vaccine, because they're interacting epidemics, and it's an opportunity to do prevention beyond just one infection, but rather in that syndemic, that interacting epidemic model that really addresses what people need in their daily lives and their health-seeking behavior. So it's definitely a very important finding, and one that I think, as early as September of last year, CDC actually included monkeypox or Mpox on the list of opportunistic infections. So it's already there, and I think that this study just affirms the fact that we need to sort of be holistic in our prevention approach, including HIV and Mpox.